going to be doing your head and neck portion of your examination. Can I please get your full name?
Juliana Abraham.
Okay, Juliana, before we begin, I'm going to wash my hands.
Blood glass. When walking in, it is important to state to the patient what you're going to be doing. Immediately after, you should wash your hands. In a clinical setting, we'll be washing them with water and soap. But for today's video, that is not available to us.
Okay, so now I'm going to be inspecting your scalp and your face.
When inspecting the scalp and face, it is important to look for any irregular lesions, markings, check for symmetry on both sides of the head, and when inspecting the eyes, it is important to pull down and to pull up. Also, you are allowed to check the eyebrows as well.
Okay, so if you could put your head down for me. Just going to be looking in. Okay, I see no lesions, no marks. Do you feel any tenderness?
No.
No? Okay, perfect. Can you look up? Go ahead and be checking your eyes. Can you look up? Look down. Okay, face looks symmetrical. Juliana, so for this portion, we're going to do the visual acuity. Before we begin, do you wear glasses?
No.
No? Okay, perfect.
In the visual acuity portion of the examination, it is important to start off with the 20/20 look. You must tell the patient you are assuming you're 20 feet away. In the 8th line, we will ask them to read the first 3 letters with both eyes. Following, we'll ask them to read the second 3 letters covering one eye. Then we will ask them to finish off with the last 2 letters covering the other eye.
Okay, so for this situation, we're going to just pretend we're 20 feet apart, okay? Can you please read the first 3? D, E, F. Okay, can you cover your right eye? Read the middle 3. P, O, T. Okay, and cover your other eye. And read the last 3. E, C. Okay, perfect.
A patient should never have their glasses on, except if it's for the visual acuity test. In this case, you would ask the patient to politely put their glasses back on.
You wear glasses?
Yes.
Can you put them on, please?
Yes.
Alright.
So now we're going to be doing the wiggle test portion of your examination.
When performing the wiggle test portion of your examination, it is important to ask the patient to not move their head and keep their eyes fixated on one point. When performing, we will keep our hands behind their head, approximately shoulder width apart, and we will have ourselves at the same level of the patient. We will move until they are able to see our hands, and then we will wiggle our fingers 4 times.
Okay, so what I'm going to do is go right behind your head. If you could just look straight at my nose and don't move your head. Let me know when you can see my hands.
Anything.
Perfect. Let me know which one's wiggling. Top, bottom, bottom, top. Perfect. Now I'm going to be performing the H test.
When performing the H test, it is very important to ask the patient to keep their eyes fixated on one point of the pen. When performing it, make sure you go a full shoulder width apart and take your time as well.
Okay. So I'm going to need you to not move your head and keep your eyes on the prize, okay? Okay, Juliana, so now I'm going to be doing the pupil constriction portion of your examination. But before we begin, I'm going to go and dim the lights, okay?
In this portion of the examination, we're going to go ahead and ask the patient to look at our nose, keep their eyes fixated. Then we're going to go ahead, flash once. Look at the other pupil, second flash. Switch hands, repeat, other pupil.
So if you could please look at my nose. Okay. I'm going to do one eye. Okay, perfect. Keep looking at my nose. Okay, so now I'm going to be checking for your red reflex. But before we begin, I'm going to completely turn off the lights, okay?
For this portion of the examination, we're going to completely turn off the lights. We're going to ask the patient to look off into a distance. We're going to ask the patient if we could get close to their face. When examining their right eye, we're going to be holding it with our right hand and looking with our right eye. So guess what we're going to do for the left? We're going to do it with our left hand. We're going to look with our left eye. It's very easy.
Okay, Juliana, so before we begin, I'm gonna have you look straight off into the wall, okay? And there's gonna be a little light in your face. Is it okay when you're close?
Yes.
Perfect. So I'm gonna look to the other eye. Okay, perfect. Okay, so now that we're done with the red reflex, I'm gonna go turn on the lights and we're gonna start the ear portion of your examination, okay?
So, for the ear portion of the examination, we're going to start off by inspecting both ears, make sure there's nothing irregular going on there. We're going to go ahead, palpate the ears, look for any pain or tenderness, pull down, pull up and back. Then we're going to go ahead and inspect the ears. When looking at the right ear, we're going to go ahead and hold it with our right hand, lay it against the patient's face, and we're going to pull their ear up and back. And guess what? When we're going to the left side, we're going to do it with our left hand, up and back.
So now I'm gonna check your ears. Nothing's wrong. No lesions and no masses. Let me know if you feel any pain or tenderness. Nothing? No. Okay, perfect. So now I'm gonna start by looking in your ear. Okay. Perfect. I'm gonna check the other side. To finish off ears, I'm going to do the rubbing test. So I'm just going to stand right behind you.
This one's pretty self-explanatory, guys. We're just going to come behind the patient. We're going to go ahead, rub, see their hearing in the right ear, see their hearing in the left ear, make sure everything's in check.
Okay, so let me know which ear you can hear this noise. The right, left, right. Okay, so now I'm going to be checking your nose and mouth for this part of your examination.
Okay, guys. Mouth is pretty easy. Not much we got to do. We just got to look inside of there. We're going to go ahead and ask them to open their mouth, ask them to move their tongue in all directions, left, right, down, up. We're going to go ahead and ask them to say ah. Then for the nose, we're going to palpate down the nose first. Feel for any pain or tenderness. Palpate the sinuses. Then we're going to inspect in the nose.
Okay, so you can say ah, stick your tongue out, to the left, the right, up, down, and say ah. Okay, perfect. And say anything abnormal. Now I'm going to check your sinuses. Let me know if you feel any pain or tenderness. No? No. Okay, I'm going to check down your nose. Any pain, any tenderness? No? Okay, perfect. So now I'm going to ask you to look up. I'm going to check inside, okay? There's nothing in it. Yeah, so now I'm going to be checking on your lymph nodes.
When we're palpating the lymph nodes, we're going to take our index and middle finger, put them together, and rotate in a circular motion. When looking at the submental, ask the patient to look down. And when looking at the supraclavicular, we're going to ask the patient to remove their garment so we can properly feel it.
Okay, so now I'm going to be checking off some spots. 1, 2, 3, 4, 5, 6. Can you look down? 7, 8, 9. And can you put it down? Look down. 10. We'll be checking your thyroid.
Okay guys, this is a bit of a long one, so bear with me. Well, we're going to inspect the thyroid, make sure there's no irregular masses or lesions, feel down the throat. Then we're going to come behind the patient, look for the thyroid, move a little lower, push on one side, ask them to swallow. While they're swallowing, we're going to feel a little bit. Then we're going to do the same on the other side, ask them to swallow, be pushing, and then feel as well.
Okay, so if you can look up for me. Okay, there are no lumps, no lesions. Now I'm going to check. Do you feel any pain or tenderness?
No.
Okay, symmetrical. So now I'm going to go around. Okay, I'm going to locate the thyroid. Okay, I'm going to go down a little. Swallow. Okay, perfect. Swallow again. Okay, perfect. And that concludes this portion of our examination, okay? Any questions for me?
No.